In 1 minute about the DaVinci surgical robot. Have you heard of a robot that can perform surgery inside the grape's skin? This is not science fiction. This is the real DaVinci surgical robot. Imagine a grape, its skin as thin as a cicada's wing, and the DaVinci robotic arm can perfectly stitch a seam on this grape skin without breaking it. This level of extreme precision, which is difficult for us to achieve even with our hands or eyes, is the daily routine of the DaVinci robot. It's like giving doctors a pair of God's hands and a pair of God's eyes. Through the lens, the doctor can see a three-dimensional image magnified more than 10 times inside the body, with every blood vessel in love clearly visible, as if they were performing surgery inside the patient's body. The doctor's hands operate on the console, and the robotic arms can simultaneously perform inside the patient. A crucial aspect is that it can filter out the natural slight tremors of human hands, making movement as steady as a machine because it is a machine. Therefore, using the DaVinci for surgery has simple and direct benefits. Smaller incisions only needing a few small holes without making a long cut, resulting in less bleeding. The movements are so precise that they can perfectly avoid important blood vessels. Recovery is fast, trauma is reduced, and patients naturally recover quicker, being able to be discharged in just a few days. However, there is a small issue with such a great machine. It is so advanced that almost only one American company in the world can make it, essentially monopolizing it. It's like there's only one store in the world selling this hand of God, so the price is naturally very high. Moreover, the core technology is in the hands of others. This means that if the machine encounters a complex malfunction, we might have to wait for technicians from across the ocean to resolve it. Precisely because of this bottleneck, our country has also started developing its own surgical robots, such as ToMe in Shanghai, to enable more Chinese hospitals to use and benefit from this technology without being constrained by others. For example, just last July, a legendary story occurred. Professor Liang Xiao from the Xiao Yifu Hospital affiliated with Zhejiang University School of Medicine successfully performed a precise resection surgery on an 80-year-old liver cancer patient in Hangzhou, Zhejiang, who was 10,000 kilometers away, using the domestically produced ToMe surgical robot while attending an international academic conference in Strasbourg, France. Professor Liang Xiao's operational instructions in France were transmitted almost in real time to the surgical robotic arm in Hangzhou. The entire surgery was successfully completed in only 50 minutes with very little blood loss, and the patient recovered quickly. At that time, thousands of experts from around the world witnessed this scene at the conference, and the praise was endless. So next time you hear that a relative or friend's surgery was done with a robot, don't be too surprised. It might very well be the DaVinci or our own Chinese tool, Mai, and all these silent efforts are for one goal: to firmly hold the initiative of life in our own hands.